I'm going to go in reverse order, if I can find them all. All right. Partial rebreather, non-rebreather. I already talked about a little bit as to why you would use this. It is not a long-term device use. It's an emergency, short-term, decreased worker breathing device. So the patient that goes into distress and needs a high FiO2 quickly. We won't leave them on this for days. Typically, it's quick, long enough for us to get them stable and where they need to be, and then get some blood work done to see what they need done. Do they need oxygen? Do they need ventilation? What do they need? All right. So if it's a non-rebreather, turn the flow up to at least 10. If the bag deflates by more than a third, turn it up more, and it's 60 to 80 FiO2. Partial rebreather. Take the discs off. Is now a partial rebreather. Same usage for it. Same disadvantages. The FiO2 for this is 40 to 60. And same thing with set it to 10 liters. If the bag deflates more than a third, add more liters. Simple mask. Simple mask. The simple mask ran away. There's that. There's this. I'll find it. Well, that's not a simple mask. Simple mask. All right, the simple mask. 35 to 50-ish% FiO2, 5 to 10 liters, never less than 5 because the CO2 builds up. This is good for a patient who needs more long-term oxygen and is a mouth breather. This is common for post-surgical things, minor illnesses where they're not keeping their oxygen levels up high, but they don't want to wear a nasal cannula, or they need a slightly higher FiO2. This is what we'll use. And it's simple because there's no holes. It's just a simple mask. Reservoir cannula. This is for a patient that needs the FiO2 range of a nasal cannula. They are usually on long-term oxygen device, and this is what we use to help them save money because it doesn't use as much oxygen. There's not as much waste because it builds up in the reservoir. Same advantages and disadvantages as an actual cannula, which we're going to talk about now. The nasal cannula way over here. I threw it too far. There we go. The nasal cannula, 1/4 to 8 liters or 6 liters, depending on what book you read. This can be long-term, short-term device. Patients who are in mild distress, patients who have a hard time keeping their oxygen levels up. This is what this is our go-to. This is our first stop. If it's not a trauma and not a severe distress, this is our first stop. Like one fits all, which is not true because there are different size nares and size tubings. So the peds, this area right here is a little bit smaller, and the nair holes are not as long and they're not as narrow. There's also like extra large for the big men who have really big nasal passages that have longer and wider prongs. You want the prongs to be about half the size of the nares or less. So you don't want it more than half the size. It's cheap, it's easy. It fixes just about everything. But wait, there's more. All right, so over 4 liters, you have to add humidification to this one. And with the simple mask and the nasal cannula, we can estimate the FiO2 that the patient is getting by using the formula 20 plus 3.5 times the liter flow. Every liter that you give of oxygen increases the FiO2 by 3 to 4%. You can use 3 or 4 or 3.5. It does not matter. Whichever you feel more comfortable doing math-wise. only two devices you can do that with. So you can estimate how much FiO2. The doctor comes in and says, what's his FiO2? You can say it's about, and do the estimate math in your head for nasal cannula and simple mask. Partial breather, non-rebreather, you cannot do any math. You just know it's somewhere between 40, 60, 60, 80. If somebody tells you it's 100, you're going to say yes and just go about your day and know that you know more than they do. Don't argue. It's just not worth it for this device. And for that reason, because it's not going to hurt anybody, it's not going to kill anybody. They just don't know what they're talking about. There will be times when we are learning things and I tell you, you need to speak up about this one because it could kill somebody, because the person doesn't know what he's talking about and he's about to do something wrong. This is not one of them. So the reservoir, used to save money. Resuscitator bag, positive pressure ventilation, PPV, or bag mask ventilation, BMV, or an ambu bag. They're all the same thing, just different names. You have the mask that goes on it. You're going to learn next week in lab. Hopefully we'll be back in class and you will learn how to bag me and Erica. So that is your oxygen device lab. Have a good rest of the week off.